At our clinic, we specialize in treating major depressive disorder using a therapy called Transcranial Magnetic Stimulation, or TMS. Many people have heard of TMS, but did you know that there's different types of magnetic coils that impact how well you respond to treatment? If you're considering TMS and you want to know the difference between the Brainsway coil and the older figure 8 coils, along with which one you should try, stick around and I'll try to answer that question. Hi everybody, I'm Dr. Brendan Rowe, and I'm a doctor of nursing practice and a psychiatric mental health nurse practitioner, and this is Real Talk Mental Health in Vancouver, Washington, where we talk about mental health from the provider's perspective. If you think that sounds interesting, click on the subscribe button and hit that little bell and we'll notify you of new videos. One of the most effective ways to treat major depressive disorder that isn't responding well to medication or therapy is with an evidence-based treatment called Transcranial Magnetic Stimulation, or TMS. With TMS, we use an MRI-strength magnetic coil to stimulate different parts of the brain to treat different mental illnesses. If a person has already tried 3 or more antidepressants combined with therapy and they continue to struggle with depression or anxiety, they should absolutely consider giving TMS a try. But did you know that there's different magnetic coils to choose from and that not all TMS is created equally? There's several key differences between traditional repetitive TMS and deep TMS. These include the scope of their magnetic field activation, their level of treatment efficacy, and the FDA clearance. Due to their differing equipment and technology, the magnetic fields created by traditional and deep TMS differ in their size and scope of activity. Traditional repetitive TMS relies on a figure 8 coil design, which only reaches a depth of 0.7 centimeters. Deep TMS, however, uses a more 3-dimensional H-coil helmet, which manages to encompass a broader surface area and stimulate deeper brain structures directly, reaching a significant subthreshold of around 3.2 centimeters. Deep TMS's advantages lie in its combined ability to not only directly regulate deeper structures linked to mental health conditions like depression, but also to safely target more of these crucial structures during each session. This is because with deep TMS, the magnetic fields spread over a wider area of the brain, while traditional repetitive fields are activated through a narrow prism, increasing the risk of missing the target brain structures. So putting it simply, deep TMS has a wider scope of activation and reduces the likelihood of missing our target, which improves your chance of achieving remission. Since brain structures are not located in the exact same spot for everyone, it's really important to make each session count. So recent studies have pointed to the fact that managing to regulate more of the relevant structures can lead to a decrease in symptoms, resulting in greater quality of life. An independent 2019 study published in the Journal of Psychiatric Research actually found that the difference between both treatments significantly favored deep TMS. So noting that patients with moderate or severe depression had even better responses and higher remission rates than those people who went through repetitive TMS using the figure 8 coil. Traditional repetitive TMS using the figure 8 coil first received FDA clearance for major depressive disorder in 2008. Deep TMS first received its FDA clearance in 2013, and then was later approved for OCD in 2018, and then smoking cessation just in 2020. Brainsway is working to expand Deep TMS's clearance status to treat additional brain disorders and addictive behaviors with its proven effective technology. Technology has improved at a rapid pace over recent decades, which means you should be informed about your options to maximize your experience. Clinical advantages of Deep TMS over traditional figure 8 coils have been validated through independent head-to-head studies of TMS technologies. With an advanced product using cutting-edge technology to offer greater results to patients, it's very clear to me why Brainsway is leading the charge when it comes to safe, effective, and study-backed treatment options for those who need it. So if you're struggling with depression and anxiety and you feel stuck, hang in there, because there is help. And if you're in the Portland, Oregon, or Vancouver, Washington area, reach out to us at TMS Northwest. We would love to help you.